It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In the last blog, I shared a newspaper and also online article about Dion Detterer, a young man in the Blue Mountains in Australia in New South Wales, trying to get intensive home care nursing so he can finally get the care he needs and deserves to stay alive. So last week's blog was Dion's fight to overcome muscular dystrophy so he can continue helping others. You can check out last week's episode by clicking on the link below this video. In this week's blog, I want to share mismatch between demand and supply of end-of-life care, introducing competition and informed user choice into human services, reforms to human services. It is widely known that end-of-life care is scattered and unavailable. In a country where 75% of people want to die at home, if given a choice, and yet less than 15% of people actually do die at home, it is needless to say that the vast majority of people, when approaching the end of life, do so in an institution. Finally, the Australian Productivity Commission released a report in relation to consumers' choices at the end of life. The report suggests that what we have been saying for over 5 years. Competition needs to be increased, and choices for people at the end of their lives need to be made available. The report also highlights that home care services in general are not readily available and lack quality control. Again, something we have been saying and also doing for a long time. Many services in home care lack standardization and quality control, such as third-party accreditation like we have. It simply can't be in the interest of the general public if an intensive care bed costs $5,000 per bed day, and long-term intensive care patients can be looked after at home with a quality service like ours, intensive care at home, for 50% of the cost of a hospital intensive care bed. Therefore, increasing competition is a good thing, and it will bring costs down, frees up hospital and intensive care resources, and it creates care models that are more holistic and more patient and family friendly. So the following information was released last week, and I put some links to those websites where it was released. And I just read this out to you so you have an idea what the article actually says. The Productivity Commission is the Australian government's independent research and advisory body. It just released a report titled Introducing Competition and Informed User Choice into Human Services, Reforms to Human Services. The report includes a chapter on end-of-life, making several recommendations. The Australian, state and territory governments should work together so that Australians can access end-of-life care that better matches their preferences. This will require governments to put greater focus on providing end-of-life care in the place where a person lives. Number 2, a significant increase in the availability of community-based palliative care services is required. To achieve this, state and territory governments should assess the need for additional services, select providers, typically using competitive processes, and adequately fund those providers. Establish standards for community-based palliative care services and fund the delivery of those services for people who wish to and are able to die at home. The standards should include integrated and coordinated nursing, medical, and personal care. It should also ensure that monitoring frameworks and consumer safeguards are in place so that, again, quality care is provided and oversights are maintained as the volume of services provided increases. Available evidence indicates that the saving from avoiding a single hospital admission for palliative care, costing about $11,000, would more than cover the cost of providing community-based care over a period of months, costing between $6,000 to $10,000. Number 4. People living in residential aged care facilities should receive end-of-life care that aligns with the quality of that available to other Australians. Delivering this will require the Australian government to remove current restrictions on the duration and availability of palliative care funding in residential aged care, so that clinical care is available to all residents at the end of life, and also fund this additional care and ensure that clinically trained staff hold timely conversations with aged care residents about their future care needs and also preferences, and support residents to prepare an advanced care plan if they wish to do so. Number 5. General practitioners and practice nurses could play a much larger role in helping people to articulate their preferences for end-of-life care through advanced care planning. Changes to Medicare item numbers are needed to enable this. Number 6. The effectiveness of the above reforms will depend on governments implementing broader improvements to their stewardship of end-of-life care. This should involve the Australian state and territory governments through the COAC Health Council. And that means cooperating to plan, fund and set standards for end-of-life care so that patients receive high-quality care in each setting and in each jurisdiction. It also includes developing and implementing an end-of-life care data strategy that establishes a national minimum data set for end-of-life care and improves the accessibility and use of data. And also, it includes commissioning an independent review in 2025 of the effectiveness of end-of-life care across all settings in which it is or should be provided. If you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, also nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator or with other medical complexities, if you want to know how to get funding for our service, or if you have any questions, please send me an email to patrick@intensivecareathome.com, and that's Patrick just with a K at the end, or call me on one of the numbers on the top of the website. Also, have a look at our career section. We are currently hiring ICU and pediatric ICU nurses for clients in Melbourne and in South Gippsland, Victoria. We are also an NDIS, TAC and DVA approved community service provider in Australia. We have also been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies last year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.